Hello again, everyone, and welcome back to Reddit Aliens. I am John, and as always, thank you so much for being here. A little gross today, but fun. Let's do it. Doctors, nurses, redditors. What's the most gory experience you've ever been through or seen? Please remember to like, share, and subscribe. As a paramedic responded to a call of a traffic accident, baby ejected, we prepared for the worst we could imagine. Arrive in about 8 minutes, trooper on scene trying to clear the area of bystanders or gawkers and preserve the scene. He had covered the baby with the yellow death sheet troopers carry in their trunks, lifted the sheet to check vitals, pronounced death, and it was not a baby, but the top half of the 19-year-old girl that was driving the small pickup truck about 50 yards away. She was driving and arguing with her 19-year-old husband, who was the passenger. They were doing about 55 miles per hour on a 2-lane road and met an oncoming truck pulling a double-wide mobile home. She ran under the front corner of the mobile home, cutting her in half. Her bottom half remained in the driver's seat, while her unhurt husband watched as the truck skidded another 50 or 60 yards, sideswiping a minivan, sending it into a ditch upside down. When the truck came to rest, her bottom half fell out onto the ground. We also found a trail of ribs from the cab to the bed and down the pavement to the top half. It looked like a movie set. Her top and bottom looked unhurt, but from mid-chest to about pelvis was strung along the road. The husband was absolutely freaking out about what he had just seen. He was babbling incoherently, running around swinging at people, just a mess. A witness who lived right in front of the scene started having chest pains and had to be transported. We took the husband, and I called medical control and actually got orders to give IV Valium, something paramedics normally can only give for grand mal seizures. The driver of the big truck was fine, but was also very distraught at what he had just witnessed. That was 16 years ago, and I could still remember pulling up to the scene like it was yesterday. I used to be a nurse's aide. I once had to put a very obese woman on the bedpan. She was only mid-40s, and I left. She put her call light on, and when I answered, she said she was all done. I turned her on her side to remove the bedpan, only to see that it is empty. My first thought was that she had been mistaken about having pooped, but then I look and realize that her ass cheeks were so massive, her entire dump couldn't make it the length of her cheeks, and had gotten wedged in between them. Ugh. I had to dig the entire load out of her ass by hand. It was only about 2 months into the job, and it gave me some serious second thoughts. A child came to the hospital with cigarette burns dotting his torso. Almost every patch of skin that could be covered with a t-shirt was scarred. Some of the marks were old, some were very fresh. His parents said it was a skin condition. OR nurse here. This is kind of a long one. I was taking a call one night and woke up at 2 in the morning for a general surgery call. Pretty vague, but at the time I lived in a town that had a large population of young military guys and avid meth users, so late night emergencies were common. Got to the hospital, where a few more details awaited me. Pericardial abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the asshole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Amongst healthcare professionals, vague statements like that are a bad sign. My patient was a 314-pound Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning, so after I confirmed her identity and what we were working on, I figured it was best to just get her to an anesthesiologist so we could knock her out and get the circus started. She continued her theatrics, the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot though, chronic drug abusers who don't handle pain well, and who have used so many drugs that even increased levels of pain meds don't touch simply because of high tolerance levels. It should be noted, tonight's surgical team was not exactly wet behind the ears. I'd been working in healthcare for several years already, mostly psych and medical settings. I've watched an 88-year-old man tear a 1-inch diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've been attacked by an HIV-positive neo-Nazi. I've seen some shit. The other nurse had been in the OR as a trauma specialist for over 10 years. The anesthesiologist had done residency at a level 1 trauma center, or as we call them, knife and gun clubs. The surgeon was ex-Army and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen next. We got the lady off to sleep, put her into the stirrups, and I began washing off the rectal area. It was red and inflamed, a little bit of pus was seeping through, but it was all pretty standard. Her chart had noted that she'd been injecting IV drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs, but overall it didn't seem to warrant her repeated cries of, "Oh Jesus, kill me now." The surgeon stepped up with a scalpel, sinks just the tip in, and at the exact same moment, the patient had a muscle twitch in her diaphragm, and just like that, all hell broke loose. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. We all wear waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against the fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot more of this brackish gray-brown fluid out onto the floor until within minutes, it was seeping into the other nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tiptoes to keep the stuff from soaking his socks any further. The smell hit them first. Oh God, I just threw up in my mask. The other nurse was out. She tore off her mask and sprinted out of the room, shoulders still heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't effing breathe. My lungs simply refused to pull any more of the stuff in. The anesthesiologist went down next, an ex-NCAA D1 tailback, his 6'2" frame shaking as he threw open the door to the OR suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist keeps playing in my head. Is this real life? In all operating rooms everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there's one thing the same. Somewhere, there's a bottle of peppermint concentrate. Everyone in the department knows where it is. Everyone knows what it is for. And everyone prays to their gods they never have to use it. In times like this, we rub it on the inside of our masks to keep the outside smell at bay long enough to finish the procedure and shower off. I sprinted to our central supply, ripping open the drawer where the vial of ambrosia was kept, and was greeted by an empty effing box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil and not replaced a single effing drop of it. To this day, if I figure out who it was, I'll kill them with my bare hands, but not before cramming their head up the colon of every last meth user I can find, just so we're even. I darted back into the room with the next best thing I could find, a vial of mastisol, which is an adhesive rub we use sometimes for bandaging. It's not as good as peppermint, but considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. I started rubbing as much of the mastisol as I could get on the inside of my mask, just to be smelling anything except whatever slimy demon spawn we just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask, so he could stand next to his machines long enough to make sure this woman didn't die on the table. It wasn't until later that we realized that Mastisol can give you a mild high from huffing it like this, but in retrospect, that's probably what got us through. By this time, the smell had permeated out of our OR suite and down the 40-foot hallway to the front desk, where the other nurses still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh, so dirty. I stepped back into the OR suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy in blue surgical garb, standing nearly ankle-deep in lumps of dead tissue, fecal matter, and several liters of syrupy infection. He was performing surgery in the swamps of Dagobah, except the swamps had just come out of this woman's ass, and there was no Yoda. He and I didn't say a word for the next 10 minutes as he scraped the insides of the abscess until all the dead tissue was out. The front of his gown was a gruesome mixture of brown and red. His eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks closed to hold the dressing for as long as possible, woke her up, and immediately shipped off to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out 70% isopropyl alcohol is about the only thing that can even touch a scent like that once it's soaked into your skin. It takes 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little of it too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I heard him utter in 2.5 years of working together. That was bad. The next morning, the entire department, a fairly large floor within the hospital, still smelled. The housekeepers told me later that it took them nearly an hour to suction up all the fluid and debris left behind. The OR suite itself was closed off in quarantine for 2 more days just to let the smell finally clear out. I laugh now when I hear new recruits to healthcare talk about the worst thing they've seen. You ain't seen shit, kid. TL, DR, don't shoot IV drugs into your taint. You know, about halfway through, I realized that we have read this story before, probably like 2 years ago, but it stuck with me, and it is disgusting. So I hope you don't mind hearing, I guess, what you could call one of our greatest hits. So yeah, oof. And if it's your first time hearing it, I'm sorry. Autopsy tech death investigator. A morbidly obese man had died in a cheap motel room with the heat cranked up and wasn't found for several days. By the time we got him to the morgue, he was horribly bloated from decomp gas and was purple and green all over. There were lots of skin slip. A forensic pathologist went to make the initial Y incision, and the force of the escaping gas blew gore all over us in the ceiling while making us sound like a wet balloon with the air being pinched out. We all paused for a moment, as the worst stank I've ever smelled enveloped the room like something that had crawled out of Satan's anus. Then we burst out laughing, because it was all we really could do. It didn't help that he was leaking liquefied fat all over the floor. That shit is slippery. My boots have never been the same since. TL, DR, got hit by boomer gore. In my EMT class, an instructor was telling me about one of her calls to a freeway accident. There were 2 cars involved, and one of them had an elderly couple in it. Since she was so small, my instructors often assigned the job of crawling through the windows of the car to stabilize patients while the crew works on prying the doors open. She crawled into the back seat of the elderly couple's car and held manual C-spine for the woman holding someone's head in place to prevent an injury by twisting the spinal cord. As she held the head, it came off in her hands. The woman had been decapitated by the accident. She had to take a couple weeks off after that and talk to a therapist to help cope. I can't imagine what it must have been like to go through something like that. ERRN here. This, so far, is the only death I've experienced from work that I've lost a significant amount of sleep over. 24-year-old male walks into the ER with complaints of flu-like symptoms for the past 3 days. He had decided to come in that day because he started to develop a rash throughout his body that he was unfamiliar with. Sadly, this rash was actually the result of a failed battle with bacterial meningitis, causing him to bleed internally and externally. By the time we got him back into the ER, he started crying blood, and the terror in his eyes was palpable. He went downhill fast. His lucidity diminished with his blood pressure, as the last thing he said before succumbing to pulseless VTAC was something about his mother that we could not make out. You could see his consciousness fade from his eyes as we started compressions. The code lasted close to an hour. At first, we could still keep his oxygen levels up with mechanical ventilation, defibrillation, and drugs, but blood was filling his airways faster than it could be suctioned out. He was bleeding too fast for any medications or fluids to keep his blood pressure up. He died soaked in blood and nearly unrecognizable due to his now almost uniformly purple skin and swollen face. We later found out that he was studying neurobiology, had a devoted girlfriend that was for all intents and purposes a fiancé, a large family, and many friends. He was an athlete who lived healthy. He had beautiful curly hair. This made the death tragic in a way that you just don't experience when an 80-plus-year-old dies. It made the unanswered pleas to God for help that had been sent echoing around the room by his family all the more bitter. I helped drag and push him into a body bag. My dad had been a nurse for nearly 20 years. He's moved around from working on the ER to radiology and now the ICU. He's one of the most well-respected nurses in the hospital. I would know because I worked at the same place as a phlebotomist. Anyway, our hospital is a bariatric center of excellence, so you know what that entails, some pretty big patients. So this one day, I go up on the 4th floor into the neuro unit to get a blood draw, and as soon as I step off the elevator, I smell shit. Really foul, rotten, egg-smelling shit. I don't think too much of it, as the hospital is older and poorly ventilated. I know, right? But when I get home, I ask my dad about it, since the ICU is on the same floor. He said that they had a guy who was 550 pounds in the unit, and he was having some abdominal pain. Turns out, he hadn't had a BM in almost a month. Before he was transferred to our ICU, other clinics had tried giving him a few enemas to no avail. So my dad is saying that he's putting in one of those balloons into the guy's anus so he can attach a bag like a catheter. He turns around to check a monitor, and he heats the dripping noise behind him. Turns back around, and there is a river of shit falling from the bed. The entire floor is covered in a month's worth of shit, dripping, splashing all over everything, including my poor dad. He and the nurses roll up their scrubs like they're going clamming, and after an hour or so, get this guy cleaned up. Housekeeping stopped by and just left a cart for them and said, nope. I guess right after they finished cleaning, it happened again. I don't even want to imagine the smell in that room, if it was enough to stink up the whole 4th floor. I can't begin to describe the respect I have for nurses.